and welcome to the first in a series of podcasts to get you through ARRT Registry Review. We will work our way through the 2022 content specifications and cover each section. We will start with the patient care category. This section of your exam contains 33 questions and covers the sections of ethical and legal aspects, interpersonal communication, ergonomics and monitoring, medical emergencies, infection control, handling and disposal of toxic or hazardous materials, and finally, pharmacology. Today, we're going to talk about one of the most important but often overlooked parts of being a radiologic technologist, understanding the ethical and legal aspects of patient care. This is a big part of your ARRT registry exam, but even more importantly, it's what keeps our patients safe and helps you practice confidently and professionally. So grab a coffee, sit back, and let's walk through what you need to know. So why does this matter? When we work with patients, we're not just taking x-rays or operating equipment, we're also building trust, protecting their dignity, and making sure their rights are respected. At the same time, we have legal and professional responsibilities to follow. So knowing these principles helps you take better care of your patients and keeps you out of trouble. Let's start with patients' rights. Every patient you work with has certain rights that you, as a technologist, are expected to respect. First up is consent. Before we perform a procedure, the patient has to agree to it. For example, informed consent means the patient has been fully informed, they understand what you're going to do, why, what the risks are, and any alternatives. This is required for invasive procedures. Sometimes you will only rely on oral consent, like when you explain a routine chest x-ray and the patient says, okay. And in emergencies, there is implied consent. We assume the patient would want care because it is in their best interest. Next, we look at confidentiality. You've probably heard of HIPAA, the Health Insurance Portability and Accountability Act. This law says that you can't share patient information with anyone who isn't authorized to have it. That means no gossiping about patients, no chatting about cases on elevators, and only accessing the information you need to do your job. Then there is the Patient Care Partnership, which you might know as the Patient's Bill of Rights. Here are a few highlights. Patients have the right to privacy. We should always shield and drape them appropriately and keep their information private. They have the right to decide how much care they want. So if there is a DNR, a Do Not Resuscitate order, we must honour that. They are entitled to access their medical information and ask questions about it. They can also have legal documents like a living will or a healthcare proxy. These are basically instructions for their care if they become incapacitated. And finally, patients have the right to say no to being part of research. They must give consent for any research participation. So at the bottom line, respect the patient's choices, keep the patient's information private, and make sure the patient understands what is happening. Section 3. Legal issues. Now let's talk about the legal side of things. We are professionals, and the law holds us to certain standards. The first step in protecting yourself legally is verification. Always double-check the patient's identity, use at least 2 identifiers such as the name and date of birth, and make sure the exam you are about to do matches the order and the clinical reason for it. Never just assume. You also need to know some common legal terms: battery, performing a procedure without consent, negligence, not using reasonable care and causing harm, malpractice, professional negligence, when your actions don't meet the expected standard of care. And here's one ethical term you'll hear a lot: beneficence, which simply means acting in the patient's best interest. There are also some legal doctrines that you should know. Respondeat superior. This means your employer can be held responsible for your actions at work. And also res ipsa loquitur. The thing speaks for itself. if harm happens in a way that clearly points to negligence. Another issue that comes up is the difference between restraints and positioning aids. You can use sponges, straps, and sandbags as positioning aids without a problem, but using restraints, which would be anything that restricts a patient's movement, usually requires a physician's order. One area you may not think about is manipulating electronic data. You are not allowed to change exposure indicators to hide bad technique, crop out anatomy that was actually imaged, or adjust brightness and contrast in ways that misrepresent what's really there. Always preserve the integrity of the image. And then finally, documentation. If something unusual happens, like an adverse reaction or a change to the doctor's order, document it clearly and factually. Good documentation can protect you if there is ever a question about what happened. Section 4. The ARRT Standards of Ethics. And of course, we can't skip the ARRT Standards of Ethics. This document has two parts. The Code of Ethics, which is aspirational, is about being honest, competent, and respectful. Section 2 is the Rules of Ethics. These are enforceable. Breaking these rules can cost you your certification. For example, violations include things like falsifying records, practicing outside your scope, breaching confidentiality, or being under the influence on the job. So keep those in mind. They're your professional guide. Alright, that's a lot to take in, but these principles really are the foundation of good patient care and professional practice. Respect your patients, protect their rights, and always follow the rules and standards you've learned here. Thank you for listening, and keep up the great work as you prepare for your exam and your career. And I'll see you on the next one.